And we are back on Saturday mornings on WHP 580. Michael Parks, along with the rest of the Saturday morning crew, taking care of business, taking care of our local businesses, learning all about them, and finding out about some of the great products and services that they offer to us here in Central Pennsylvania. A lot of times, many of the products and services you may not be aware of. And of course, it is our mission here on Saturday mornings on WHP 580 to help promote our local businesses, because nowhere will you get better selection, service, and value. And in this particular case, nowhere will you get better medical treatment than with our local businesses. It's a pleasure. And these guys have been with us, right from the beginning. They are our friends at CPRS Physical Therapy. And back after a leave of absence, and joining us today is our good buddy Jeff Schiltz. Good to have you back, Jeff.
Pleasure to be here.
And we're going to be talking about the hip today for people who have hip pain, maybe have hip surgery, recovering from hip surgery, or looking, maybe considering hip surgery. If you have any of those ailments, then we've brought the best in from CPRS Physical Therapy, and also a local doctor and a physician, Dr. Deluca, who's going to tell us more. So let's get started with CPRS. Some of the folks may be tuning in for the first time and haven't heard about you or heard from you. Tell us a little bit about CPRS.
Well, CPRS, Mike, is it's an employee-owned company, which I feel really separates us from some of the other companies that do what we do. I do believe with being employee-owned, our care meter is a little bit higher. We look for ownership mentality with all of our professional staff. We have 27 offices in numerous counties to service all those individuals for their physical therapy needs.
And we decided today to cover the hip, and we have two great guys to cover those areas today. Tell us about that.
Very honored today. Dr. Deluca from the Orthopedic Institute of Pennsylvania, with his compressed schedule, was kind enough to find time to stop by today and talk about surgical of the hip, and Mark Brown here also from CPRS Physical Therapy to talk on the PT aspect of the hip as well. So we're very, very honored that they're able to take this time and join us here today.
And I can talk about somebody recovering from the hip. Mark was good enough to work with my wife, and Mark, she's doing great. Doesn't complain about the hip, complains about me, but she doesn't complain about her hip problems anymore. So, Dr. Deluca, let's talk a little bit about you are at OIP. So tell us a little bit about OIP and some of the work and things that you do over at OIP.
Orthopedic Institute of Pennsylvania is a 20 orthopedic surgeon group. We specialize in all fields of orthopedic surgery, from spine surgery, hand surgery, foot and ankle surgery, joint replacements, sports medicine, pediatrics, fracture care. I myself have been with OIP for 6 years now. I'm a general orthopedist, meaning I do a little bit of everything, kind of a jack of all trades, master of none. But I have special interests in the hip is one of the fields that I'm most interested in with orthopedic surgery.
I always ask, when we do these programs, and because if you don't experience that type of pain, then you probably don't think there is anything like it. But hip pain is quite prevalent in the people here in Central Pennsylvania. And why is that? I mean, just age?
The hip is an interesting joint. We always talk about the joint above and a joint below. The joint above it is the low back, and low back pain is the most common reason patients seek medical treatment for musculoskeletal needs. And the knee's below. So the hip is in between, and sometimes is overlooked some, but can often be referred pain from the back, referred pain from a knee problem, or an intrinsic hip problem itself. You can get muscle strains in and around the hip, just like you could anywhere else. You can get bursitis around the hip. You can get arthritis, which is the second most common joint to get arthritis in, next to the knee. It's a joint that's deep inside the groin, so sometimes it can be mistaken for hernia pain. But it is fairly common and fairly prevalent, and it's something that may mask as another type of a problem until you seek a medical professional.
Now, normally what we do is when we talk with the folks at CPRS, we always talk about alternatives to surgery. But you have developed a interesting partnership with CPRS because I assume, and you can answer this, more often than not, sometimes surgery is the only answer, but then there's also what happens after the surgery. So is that why that partnership exists today?
Yeah, the physical therapists are the ones who really take care of our patients, truly. As a surgeon, I see a patient in the office. I diagnose them with a problem. 1 out of 10 patients may require an operation. The other 9 out of 10 likely will never need an operation, but they do need some treatment for their problem. And the number one way to treat it is usually with some sort of physical therapy, whether it be any of those problems I mentioned before. And the therapists are the ones that can make the biggest impact for most of those patients. And they spend a lot of time with the patients, get to know them in a much more intimate level than we do as the surgeon, seeing them for a 10 or 15-minute office visit. And then, if we do surgery on them, we really rely on the therapist to get us a good outcome for our surgery. So the therapist is a very integral and important part of operative and non-operative care for our patients.
We're talking with Dr. Steve Deluca from the Orthopedic Institute of Pennsylvania, along with Mark Brown and Jeff Shields from CPRS Physical Therapy, talking today about hip pain, hip surgery, hip rehab. When it comes to hip surgery, it's not hip replacement. There is such a thing, so you can repair the hip, or does it need to be replaced?
There are multiple options for treating the hip. The most common treatment that most patients will be familiar with is the hip replacement surgery. Mm-hmm. Hip replacement surgery, I always tell my patients, is the best surgery that we can offer in any field. 95% of patients do good to excellent.
Wow.
Knee replacement, for example, or comparison, is 85%. We talk about back surgery, it's more like 70 to 75% good to excellent results. So that's what most patients are familiar with. Myself, I have other interests in the hip that are surgical, that include hip arthroscopy, sticking a camera into or around the hip joint to alleviate some of the problems and pathologies that can develop that are short of end-stage arthritis, which would require replacement. The hip is a ball and socket. The socket is lined by a structure called the labrum, which can sometimes be torn, just like a meniscus in the knee. Meniscus surgery in the knee with a camera is a very common surgery, one of the most common surgeries we do as orthopedic surgeons. But the hip labrum can act in the same fashion and can be torn, and we can put a camera into the hip to alleviate the symptoms from that. We also are hoping to intervene at an earlier stage of hip arthritis to alleviate some of the anatomical constraints on the hip that can lead to arthritis later on in a syndrome called femoral acetabular impingement syndrome, or impingement syndrome of the hip. I'm also able to treat snapping hip syndromes, which the hip will snap or pop either in the groin or on the outside of the hip, as well as trochanteric bursitis that's recalcitrant to conservative measures, all through the camera.
We always ask this question, when is it time for folks come to see you or consider hip surgery? I know, my 55-year-old body doesn't feel good when I'm out there running and stuff like that. My hip starts hurting a little bit, but it goes away. When is a good time? I mean, is it when it's just nonstop pain, or when should people come and can see you and talk about hip surgery?
That's an excellent question, and it really depends on what the injury is, how long it's been going on, the severity. So you can have a severe pain that's been going on for a short period of time that needs to be evaluated right away. Most commonly, however, it's a muscle strain or a pulling of a muscle in or around the hip, maybe a little bit of a back muscle strain. Those usually resolve with rest, ice or heat, time, anti-inflammatory medications. If it still persists, it's ongoing, it's nagging, that's a definite time to come see the doctor. Anything acute, restricting your ability to weight bear, catching or popping in or around the hip, those are all reasons to see us sooner rather than later. When
I talk to many of your colleagues about technology and how it's advancing, almost every single day and month and year, when it comes to the hip, have there been some great advances in hip surgery and hip replacement over the last few years?
Absolutely. I tell my patients on a daily basis that as recent as 10 years ago, the hip replacement was reserved for older patients in their 70s or 80s because the components would wear out with time. Essentially, the hip is a ball and socket. When we do a replacement, we replace the socket and we replace the ball, and there's a piece of plastic that sits between the two pieces of metal. And that plastic was not really well engineered until the last 5 to 7 years. These plastics now are lasting 25 or 30 years. So as the baby boomers are hitting their hip arthritis stage, we have components that we can put in 45, 50, 55-year-old patients much more regularly with confidence that these are going to last. In addition to the actual components we're using, we also have different approaches. There's more minimally invasive approaches That doesn't necessarily mean smaller incisions. It means less invasion to the soft tissues underneath. There's approaches now where we can put a hip replacement in without detaching one single muscle. So these are exciting advances in hip replacement surgery that should lead to better outcomes for our patient and hopefully longer outcomes. In addition to the hip arthroscopy, which is the camera surgery I was referring to earlier, that has been around only for probably about 7 or 10 years. I've been doing that operation now for about 6 years, and it's always interesting to see how much more we can do through the camera rather than once again going through bigger, open, more invasive approaches.
We're speaking with Dr. Steve Deluca from OIP and Mark Brown and Jeff Shields from CPRS Physical Therapy talking about hip pain, hip surgery, hip replacement. Just quickly, is the hip pretty much like the eyes? Is everybody going to experience it as they get older, or can we? Some people just skip it and their hips work fine for the rest of their lives?
Main reasons to get hip arthritis are post-traumatic. So I see a lot of younger patients who've had previous athletic injuries, sometimes more subtle, sometimes more serious, that eventually become arthritic. Other reasons are genetic. We believe there's a genetic component to patients who get arthritis of the joints. But not everybody. It's really, some patients get knee arthritis, some people get shoulder arthritis, some people get hip arthritis. Most of the time we don't know why they get it. It doesn't always have to be both hips. It can be one. But those other things I mentioned are sometimes underlying reasons to get hip arthritis. We also see in younger patients that they have a very subtle form of dysplasia or abnormal shape to the hip that can lead to the femoral acetabular impingement syndrome, which then, if it goes on untreated, can become arthritic. And that's one of the things we're looking for to try to intervene at a younger age.
Mark Brown from CPRS Physical Therapy. And let's move on to, so now that they've reached and experienced the expertise of Dr. Deluca and the staff over at OIP, the moments after surgery, at the time to rehab, those are vital times. And this is where CPRS comes in, correct, Mark?
Yes, absolutely. But as Dr. Deluca mentioned, 9 out of 10 of those people that see him for some hip ailment are not going to be surgical. So we are seeing the primary amount of people that are non-operative and conservatively trying to treat the mechanical problems that can lead to the impingement that he mentioned. The femoral acetabular impingement can have other components besides osseous malformations. There can be muscle imbalance, training errors, those kinds of things that lead to repetitive trauma in the hip. And it's really something that can be addressed without a surgical approach. So those are the primary types of things that we see. And oftentimes, Dr. Deluca and other physicians will refer people in for therapy and try a conservative approach first, even if they have a known pathology in terms of an osseous malformation, meaning a bony problem, as he mentioned, the dysplasia, or if they have a known labral tear. It may be something that can be managed conservatively, and they can have a good outcome without having the surgery. That being said, certainly post-operatively, it's critical to restore the mobility and the normal mechanics of the hip joint so that they don't have recurrent problems. As Dr. Deluca mentioned about doing the arthroscopes and those kinds of procedures, they're trying to prevent those people from leading down the pathway of progressive degenerative arthritis. So the aftercare and doing the therapy, making sure that we restore the mobility and normal mechanics, helps to improve the likelihood that they can avoid a total hip replacement in the future.
Is there such a thing as pre-op rehab?
Absolutely. There are patients that may have some mobility restrictions or just weakness and generally not well functioning in terms of ambulation, those kinds of issues. So there are times where it's appropriate to see them prior to a known scheduled surgery. It also helps to educate the patient on what their expectations will be immediately afterwards, giving them things that they can work on at home. And generally, as Dr. Deluca said, we have more time to spend with the patient, so we can also educate them a lot about the aspects of what the expectations will be with the surgery.
All right, we're going to take a break, and when we come back, we're going to learn more about the rehab that goes on after the surgery, after the hip surgery. And again, folks, there are so many people who are out there who are experiencing pain and discomfort, and to realize that you do not have to put up with this discomfort. The technology, the expertise is there, and a lot of times, as the gentleman mentioned, surgery is not always, the option that you need. Some good rehab, but if there is a need for surgery, The technology is here, and we also have the best in our area right here at CPRS and also the OIP of Harrisburg. To learn more about Dr. Deluca and OIP, go to the website, which is oip.com, and also learn more about CPRS by go to cprsweb.com. We'll continue in a bit. We are taking care of business on Saturday mornings on WHP. Taking care of business on Saturday mornings on WHP 580. Michael Parks, along with Mark Brown and Jeff Shields from CPRS Physical Therapy, and also Dr. Steve Deluca from OIP, the Orthopedic Institute of Pennsylvania. Today we're talking about hip pain, hip surgery, hip replacement, hip rehab. If you are suffering from these pains, then please consider the folks at CPRS and also the folks at OIP. Mark, I guess that's the question. So if we already know we have hip pain, we have hip problems, where do we go? We always want to mention to the folks that a lot of times, yeah, sure, you can go see your local doctor and they can recommend or refer somebody. They may not refer, the people that you want. But there is a thing that you refer to as direct access. Tell us about that.
Yeah, direct access just means that patients can access physical therapy without the referral of a physician. Most insurances participate in the payment, and it works just like their normal benefits would. The benefits to that is that they're getting early access to a physical therapist, and a lot of times it's conservative management is going to deal with these things and address a lot of their deficits. Even if they do become somebody who looks like a surgical candidate, they're still going to end up in the hands of Dr. Deluca or some of his colleagues, but they're going to get that opportunity to access the physical therapy. As Dr. Deluca mentioned before, most of those are handled conservatively anyway, so he's seeing maybe 10 patients and only one of those may need surgery, so he's making that referral to therapy. It just goes in the other direction. We would make the referral to the surgeon if it's appropriate surgical candidate, or if we are not sure if they're a candidate, that's up to the orthopedist to make that decision through imaging and their skill set of doing a full thorough examination.
The biggest part with people when they undergo surgery or they go through these pains and stuff and they worry about getting back to their normal lifestyle, what is like a good optimum range for people to consider? How long will it take for them to get back doing the things that they love to do?
Yeah, that's a great question, Michael. It does vary, again, based on the severity, the mechanical issues that they've had, and if they have pathology. Obviously, if it's post-operatively, there are certainly some precautions in terms of their ability to return quickly. If they've had a labral repair, for instance, it's something that is not to be rushed because you want that tissue to be able to heal appropriately. So for the most conservative people that we're not seeing post-surgically, we're going to notice a difference, an improvement in their outcomes within a short duration. Usually within a month, we're going to know if we're heading in a real positive direction, that they don't need to have any other type of care. As far as getting back to their full activities, it's a gradual return. Sometimes there's activity modification required. There can be training errors and overtraining issues that people were doing a lot of running, runners that really get addicted to that everyday kind of high mileage thing, are doing repetitive trauma. So we make some suggestions in activity modification, cross-training types of things to keep them going. But, it really is difficult to pin that down. We try to give every patient a good prognosis when we do an assessment of how long we expect it to take.
Well, I just think, after talking with you guys and some of the other folks in the medical community, I'm just totally amazed. And it's such a exciting time to be alive and to realize that, in this day and age, and especially right here in central Pennsylvania, do we have the expertise and the technology available to us? And Dr. Deluca, as we wrap things up, again, I know you had a great line during the break when we were talking about patients who come into you and you tell them they need surgery. But for folks who are coming in and they have hip problems, hip surgery, it can all be good.
Yeah, like I tell my patients, if they come in and it turns out they do need a hip replacement, it's I tell them, the good news is you need a hip replacement. 95% of patients do great from this operation. There are some conservative things we do prior to that. We try medicines, we try rest, we try therapy, home exercises. But there's a lot less treatments for the hip, quite honestly, conservatively, than there are for, say, the knee or the shoulder. So a lot of times it does end up going to eventually need a hip replacement. We truly rely on the specialties of the hip therapist at CPRS and the other therapists in the area. This is a very much a hotbed for orthopedic medicines, orthopedic rehabs. So we're very fortunate to be able to offer the specialties we can in surgery and in rehab. So especially when doing the hip arthroscopy, the camera surgery, knowing we have therapists like Mark in the area who specialize in this area as well lends a lot of confidence to me when I refer my patients there for their rehab. So it is an exciting field. It's ever changing. The technologies are improving. The surgical approaches are improving. The rehab is improving. We're trying to get patients back to their regular activities of daily life in a quicker and less restrictive and prohibitive fashion. So it is a good time to be an orthopedic surgeon, an orthopedic therapist, and a patient with a hip problem in this area.
Yeah, and expect, again, folks, I realize that, a lot of these pains, you don't have to experience this pain and suffering. Talk to somebody, get some answers, bring your questions, and find out the available treatments to you. Again, there's all these people available to you, and the best are right here with us today. They are Dr. Steve Deluca from OIP. Go to the website. It's OIP.com. Mark Brown, Jeff Shields from CPRS Physical Therapy, CPRSweb.com. And don't forget to check them out on Facebook as well. Their Facebook page has lots of great tips and advice, and the guys are always participating and putting the tips and advice on there and information that will help you in your everyday life, whether it's your hip, your back, your neck, your pain, your knee, whatever. It's CPRS Physical Therapy. All right, we're going to wrap things up for today. Medical Matters is coming up next, followed by The Plant Doctor, and I will talk with you next Saturday morning at 7. I'm Michael Parks, and we are taking care of business on WHP 580.